everything about product management, I believe, is really part of who is that end user. Because you guys know you could develop a product and build it, and will they come? That's not it. It needs to be, we built this because our users said. We have an awesome researcher, part of our larger team. And we just rolled out, I am going to put a plug in for the Children's Wisconsin mobile app that we just did a launch of and rollout of this week.
Awesome.
And it was, the design, the how, everything about it is because of feedback from our families. So shout out to Jeremy and the team that did some amazing work on that. But it's about, it's about what those parents need and how can we make it easier for them.
Hey, everybody. Welcome back to another episode of Over a Pint Marketing, the podcast that focuses on the fast-paced world of marketing told through the eyes of industry veterans and our guests. There's no theory here. This is real-world practical experience. My wingman today, Mr. Kurtl, Vice President of Celtic Advertising. Celtic is a full-service, award-winning agency located in Milwaukee's historic 3rd Ward. And myself, Pat McGovern, Director of New Business Development at Acedia, an award-winning digital agency also located here in Milwaukee. Brother Kurt, today we have on the amazing Julie Gau. Who is Julie? I'm going to tell you. She is the Director of Marketing Technology at Children's Wisconsin, a hospital dedicated to the health and well-being of children here in southeastern Wisconsin. This is a huge brand. Psyched to have her on there. Julie, we are pumped to have you on the show to learn more about you, about what you do, about children's, and anything else we want to cover. Welcome to Over a Pint.
Thank you. I'm happy to be here.
Hey, Julie, we told you about this. We've got a little tradition. It's called Over a Pint for a reason. We have a pint or something close to that. Julie, what do you have today? What are you putting back?
Well, middle of my workday, so unfortunately no pint at lunchtime today. I just have a lovely cup of tea. Passion. I thought passion would be good tea for our conversation today. But later on this evening, I think we are going to try to hit a traditional Wisconsin Friday fish fry. And awesome. I see a brandy old fashioned in my future.
Oh,
very nice.
Julie, yes. You hit me with that one. Mr. Lingo, what do you got today?
Well, and riding the coattails of what Julie was saying, it is noon. So therefore I am, I'm having something a little different, but I am going with a Bofferding beer out of Luxembourg. Crisp, light. We had these folks on our podcast from ANSI International. This is one of their products back in December. Great beer, perfect for noon hour. Cheers, Julie. It's great having you on the show.
Cheers.
Guys, I'm into sours, and we've got some in the downstairs from Surly Brewing. This is their Mango Supreme. Kurt, here's a question I have for you before we get into this. What makes sours sour? I don't know what makes them sour. Do you know?
No, but we've had enough guests in the beer industry.
Right.
I mark that down as a future question. So that we get that answered, because we've had 4 or 5 on and we've never asked that. So
right, I got to find that out. But if you're into the sours, which are a little bit on the fruity side, very
tart.
IPAs. Digging right. Surly sours.
Good brewery.
All right, enough with the drinking. Let's get into this. Julie, give us the elevators speech about you, about your background, kind of inform people a little bit more about you, and then let's get into it. So take the mic.
Sure. So to me, it's almost that dreaded interview question of like, who are you and who is Julie? So yeah, as Pat introduced me, I'm the Director of Marketing Technology at Children's Wisconsin. What an honor to have the role. I'll be with Children's 1 year this month. And it's just been a fantastic adventure and journey. It's funny when I look back on my experience, now and look back on my career, you know, I've always had this mix of digital, whether it's like a digital marketing, digital experiences, being able to really get into the end user and technology. And if anybody would have told me right out of college that my marketing degree was going to be put me into like more of a product management route, I would have been like, product what? And what is this all about? But now looking back at all the different jobs I've had, you know, from the time that we worked together in the travel industry, banking, you know, healthcare, from insurance to software to now being at a health system, it all makes sense to me. But I never would have thought this would have been my path. So, you know, I've done things like, you know, more traditional, you know, digital marketing, SEO, and things like that. I led a user experience practice for a bit. And I loved that so much because then I could learn from users, and that led me into more formal product management, because then I could take that feedback from users and put it into action, build it into the products and the experiences that I was responsible for. So yeah, that's kind of loosely a little bit about like, that's what
great.
my career, you know, has been, and it's been a heck of a journey, and wouldn't change it.
That's cool. And I want to get more into the product. Obviously, we won't dive down into the product management thing a bit more. But Julie, do us a favor. For those who are listening who don't really understand Children's and that brand, just give us a little bit about what this is, because just saying, hey, it's a hospital just doesn't do it justice, right? So it is really kind of it's a big iconic brand here in this part of the world. Talk to us about that, right?
Yeah, wow, Children's really, it is. Talk about a very strong brand. That is definitely Children's. And we are, Pat, you're right, we're more than a hospital. You know, we're truly a healthcare system. We have 2 hospitals, Milwaukee, and then the Fox Valley Hospital, so up in Neenah. And, you know, I'll tell you, when my son was, you know, a little peanut, I knew Children's more for, we needed specialty care. And that is not the Children's you know today. I mean, you do know Children's today as that. You know, we have something more than like 70 different specialties that we do at Children's. We're solely dedicated to kiddos. And I think that's what's really neat about it. But it's not just about our kids who need the specialty care. We've got something like 22 primary care locations.
Wow.
We've got your urgent care locations, walk-in care when your kiddo has broken an ankle, mine a few years ago, you know, and then even expanding more, not just physical locations, video visits, video health has become huge during the pandemic, as well as behavioral health locations. So, you know, we've got all of those things. We've got a few dental locations. And I think the other part that a lot of people don't always realize about Children's is how much we're really in the community. So whether it's things like car seat safety checks and helping new parents make sure their car seats are installed properly, teen driving education, you know, my son received some of that through his high school, and even things like bereavement services, educational aspects. So Children's truly is in the community, whether it's for, you know, physical health care, mental and behavioral health care, educational programs. We even have nurses and staff into into schools, like elementary schools too.
Wow, that's awesome.
You know, it's we were talking before you came on, Julie, about just that, about Children's and how iconic and of a brand it is locally. And I told Pat, I said, what's great about the podcast is we've had some, you know, a variety of brands all over, but I said I really do get excited when we bring on some of these brands. And I don't know if local is the right word. I don't think local does do justice to a children's hospital, because it's so much more than local. The reputation is beyond, but you know, Children's Hospital, it's just huge. And we've had our kids out there as well. And you know, I think about what all of you do over there, and I would imagine there's probably, I don't know if it comes down to the Kool-Aid or the culture, but it's like, you know, we always say here, it's like our business is advertising. So we can look at it one of 2 ways. We write press releases, we do put together digital campaigns, or you could say what we're actually doing when we do these is we're helping put a family through college. If we work on a 529 account, is that the same in terms of like with all of the individuals at Children's who are part of that family, I mean, what you do is what you do, but there's probably got to be it's that higher call, right? That just gets you so excited.
I mean, for me personally, it is. And I think, if you've had experiences with Children's, with your own kiddos, I'll share two of my experiences where, getting to see our really our frontline healthcare workers in action, it just puts me in awe. And my first one, I'm almost a little embarrassed to share, but I was really nervous to get my COVID vaccine shot. I was really worried about side effects, and I was able to go in as part of an employee clinic, organized way, and get my vaccine. And the nurse who was just injecting me with the vaccine knew that I was nervous, and the way that she put me at ease clearly knew how to take care of big babies like myself. And what a difference, right? But that's more of my embarrassing Julie story. But at Children's, we have a program that we have been doing throughout really the past almost year, called our Helping Hands program. And it's an opportunity for those of us who are in non-clinical roles to be able to give a helping hand. So it's simple things like cleaning elevators, vacuuming common spaces, rolling isolation gowns, escorting families in the urgent care or our emergency department. And so one of the areas that I've had the chance to volunteer in has been in our NICU. And all I'm doing is wiping computers and folding isolation gowns and stocking them, or maybe taking out dirty linens and putting a fresh bag in. But to see our staff in action and the people who are really taking care of our kiddos in this case, the hospital, amazing, absolutely amazing. And so I think I had an appreciation coming in as, I've only been with Children's a year. So coming in as a new employee, I certainly had an appreciation as a parent, as a friend, as a family member to others who have sought care through Children's. But to then see our staff, our healthcare experts in action, absolutely amazing. And I think you have to be, I was just talking to a friend of mine last night who's in healthcare, and she said pediatrics was not her thing, but she really excelled in neurology and ICU, and that's what she loved with adults. And so it really, I think everybody has their special place. And I think in healthcare, if you have a special place for pediatrics, come to Children's and you will be able to, truly shine. And it's easy when you get up in the morning. For those of us who don't, see kiddos every day and don't have direct patient care, you get up in the morning and you see a picture of a kiddo, or you read a new story from another member of our team, or you just think about what we're doing for the day and how we're trying to help out our families. It's pretty easy to get motivated.
Cool. Well, we're gonna drill down with you, but I'll just put a period on that. That was one genuine sales pitch, and I say genuine. I hear, Pat, I'm hearing passion, and I'm hearing culture. And how many times does that come up with our guests? We talk a lot about culture and passion, and So anyway, on that note, we can drill down now. But thanks for sharing that with us,
Julie. Let's begin to pivot and talk to us about product management. Give us the what it is, and then we're going to go from what it is, and then we're going to transition a little bit more, and then into how that specifically relates to you and your role. So, take the mic and go.
Yeah, because a lot of times if you think about like children's hospital, and you're talking about product management, that doesn't really seem to make sense. So, if you think about what I guess would be more of a pure product management, they're product managers or the function, they're overall responsible for the success of a product, right? And you have it all over the place, right? You're talking about 529 plans or consumer packaged goods or software, right?
Yep.
And the way that I think about it, at least for the type of product management that I do, which is really around digital experiences, that's how I think about my product management. And it's that intersection, or the Venn diagram of like marketing, your technology, and your strategy. And I think about how all three of those come together. And I'm skipping the user, but to me, the user is just everything about it. Everything about product management, I believe, is really part of who is that end user? Because you guys know you could develop a product and build it, and will they come? That's not it. It needs to be, we built this because our user set. We have an awesome researcher, part of our larger team. And we just rolled out, I am going to put a plug in for the Children's Wisconsin mobile app that we just did a launch of and rollout of this week.
Awesome.
And it was, the design, the how, everything about it is because of feedback from our families. So shout out to Jeremy and the team that did some amazing work on that. But it's about, it's about what those parents need and how can we make it easier for them.
Sure. So now, Julie, take us down. Let's go even further down in that. So you talked about that intersection between, if I got this right, marketing technology and the user, right? Talk to us about how that applies to your specific role. Like, what does that mean? Talk to us about that.
Yeah. So, the way that, at Children's, and Pat, maybe give a little context to, where, in my case at Children's, marketing technology would be a loose equivalent to product management and maybe a more traditional organization. And, where we fall, so at Children's, we fall into the marketing, communications, and digital health and experience team. So my senior leader is our chief marketing officer. Gotcha. Sometimes you would see maybe our function in a technology area, maybe a strategy area. We fall into marketing communications. And for us, I think we're in the perfect location. And especially at Children's, and having such a strong senior leader like the one that we have. So, I think, for us and the way that I think about marketing technology and like, is it product management? Is it not? Is it a pure product management? No. But I think a lot of the skills and principles and practices of product management are just mission critical for the work we do. We are planning, we are prioritizing work, we are developing new things, we are maintaining or enhancing existing products. We are looking at how is the product performing? And, what can we do to optimize the experience? How do we look at the, analytics? How do we get that user research, that user feedback, and incorporate it and continue to build and improve on our products? And our products, are a little different. Our products are going to be, our flagship website is our childrenswi.org. Yeah. We are, we have I think we've got about 15 other different websites associated with Children's that our team manages, but most of our time is spent certainly with our flagship website, or what I call our flagship website, our intranet, with close to 6,000 employees. We might be over 6,000 employees, really important communication mechanism, as well as our, mobile app I just talked about. We have other mobile apps. And, now because of the work we're doing API development and starting to look at our API needs to be treated almost like its own product to make sure that the data that we get out of our content management system into our mobile app, into a remote patient care experience, into all these other places, we want to make sure we manage that product so we have really good quality data and can, continue to deliver on that across all kinds of different mechanisms we have.
Right. So, Julie, what I'm hearing is that your connection with marketing, especially being in the marcoms, is probably a really good position for your group, just to have that sort of connection with what's going on overall. Am I right with that?
Yeah, I really think so. Absolutely. To me, it's the perfect fit. We get from, our internal and external communications, what's happening, right? What's happening in the world with COVID. I mean, certainly we all hear that, but, we get that formalized perspective. We hear how our health system is handling COVID. So we get the internal communications aspect of it, plus our marketing and our brand area as they're working with, whether it's advertising, branding, or as they work with individual, what we would call service lines, like our heart or our cancer and different lines like that. we get that perspective in as well, our physician referrals, all of that together, having us where we sit is just such an important synergy to have. Otherwise, I think we would be, everybody's so busy anyway, right? And I think it's so easy to build up silos, even accidentally, yep. Right? Yep. And so, but at least having us under the same senior leadership just starts to break down those silos and make it that much easier for us to collaborate.
Well, what I'm also hearing too, Julie, is that you're not just a person who is building something, right? Where somebody's giving you a blueprint and goes, hey, we need this in 3 months. We need this in, 6, whatever the timeline is. You're in at the beginning. Like, this is what we're thinking about. Hey, Julie, from a product management standpoint, what do you think? I mean, it seems like you're in at the initial conversations. Am I right on that?
We definitely do get to be yes. I think we definitely, yes. Let me just start with a really easy answer. Yes, we absolutely do. And sometimes we're not we're not always the builders of it. We will sometimes partner, like with our mobile app, we have an external partner for that.
Sure.
And awesome partner, because they're specialists in that area. And then, as the team looks at the vision of what the app needs to be, the great work to get all the research and feedback from families, my piece and our team's piece is a small part of that, which is API development. And making sure the right data comes in. So for example, making sure that our doctors are, coming through the app so that a mom or dad could literally grab the app and say, okay, I want to select the Blue Mound Clinic, Blue Mound Pediatrics. I want to select my provider. I want to save it in the app. And so now when I have to go and make an appointment for my kiddo, I open up my app, my doctor is right there, I tap her, and I see a button that says schedule an appointment, and I can tap that button, and I can now schedule my appointment right through my mobile app.
Right.
Pat, I was hearing the same thing too, and earlier on, Julie, you hit on it. You had said, we build with purpose. It's not just, here's a product that's being developed for the different stakeholders and audiences that you service, but it's like, here it is, and here's why it's here. Here's its purpose. Here's the reason. I mean, that gets back to all the different legs that are involved from the research and all that. That's a part of this process.
Yeah, it absolutely is. We don't build it because hey, we will build things because they're cool, but that better be cool and have a purpose to it. And I mean, otherwise it's. And this is the case with any product, in my opinion, is otherwise it's a waste of time. It's a waste of energy. It's a waste of resources. You've got to build what your users need. Even if you're doing operational software or something, developing tissue paper.
Yeah.
Julie, you talked about this earlier. You kind of, putting words in your mouth, but you kind of fell into this position, right? It kind of evolved. You didn't set out on a course of going into product management, but here you are, right? How, if someone wants to be more intentional about it, it's like, hey, this sounds pretty cool. What advice would you have for someone who's like wants to go into this? It seems like you need so many different skill sets. How do you get into a product management space? Like, where would you focus on? Is it more marketing? Is it more technology? Is it more user experience? I'd love to get your take on that.
This will be a very lame answer. And if my college son asked me this, he'd be like, really? But, to me, it's follow your interest. I think there are some people who understand product management really early on, understand it, love it, embrace it. And then if you are that person, seek out, your undergrad program, or coursework or your internship in a product management type of area. But for those of us who get into it more accidentally, you can go into it doing so many different things. You can be a marketer. and then eventually evolve into it. You could be a subject matter expert in finance, for example, and just be so passionate about how to improve maybe a software experience, and then have enough technical acumen. Don't have to have any technical expertise, but enough acumen and an interest to be able to say, wow, I want to take what I'm doing and I actually want to influence how something is built. And so, some people come through, if you look at my leader and I come from more of a marketing background. He actually started as a developer out of college.
Wow.
And then, we just absolutely crossed paths and ended up in these types of roles. So if you don't, what I would tell my son or any college student is, if you have an interest and you have an interest in this, absolutely seek that out. Look for it in your internships and your practical experience. If you are into your career, you're like, I really like marketing, and I think I kind of like this technology thing, or I have this interest in how products are built or how they evolve, then seek out, ask questions, just start learning, and you'll find your way. I don't know that there's any one really specific path, and that's okay. I think that's very helpful for people like me who didn't know what that path was going to look like.
Julie, here's what I'd love to know, is kind of describe for us a day in the life, right? Let's say you're but let's give us something where we could kind of sink our teeth into. You're doing a web project, you're doing a mobile app, a day in the life of what are you focused on? Where's your time spent? How are you going about getting from here's something on a whiteboard to guess what, guys, this product is live, right?
Mm-hmm.
Like, kind of take us through a little bit of that and what you go through. Just love to hear that.
Yeah. So I think it depends upon where the product or the project is in the matter of its life cycle, right? Yeah. So we just launched the mobile app, and where I'm focused literally today is on data. So nothing incredibly sexy whatsoever, but we're looking at the app, we're looking at the experience, and we're seeing that some of the the doctors, our primary care doctors who should be coming into the app, they're missing. So what's missing about them, right? And so I'm digging into data and trying to figure some of that out. But as I look at that and figure it out, then I literally will flip a page in my notebook, and I have literally sketched out a diagram to say, if this is how the data is flowing today, and if this is where we have a breakdown in our data, what can we do to not just fix this, but what can we do to solve the bigger problem that's happening? And so, I started scribbling down like, ooh, I think we should do these next steps, and wait, we need to do some current state, analysis. We have most of that. We just got to pull it together. We need a working session, and then I think we need to do, this, and this afterwards. So that tends to be a little bit of my day, in the sense of there might be a problem we need to solve, and it's not always about solving the immediate problem, but
sure,
is there the bigger, it's not the Band-Aid, what's the bigger issue?
Yep.
And is that something that we need to tackle and have more of a product perspective on? So, that's a product that has just launched. If you think about our Children's Wisconsin website, there we're constantly doing enhancements to that website. So we just launched a new site search within the last 6 months, actually. So whole new technology, that came in, and now when you search, you will get much better search results. So how do we optimize that? How do we continue to look at the data and the analytics and continue to do optimization there? How do we make sure that none of our users come to the website, do a search, and get a dead end? As simple as that. So there's that aspect of it. Or we have a new project we're working on right now of how to get educational content to our families, and having our providers be able to be in Epic, the electronic health record, to be in Epic and say, you know what, Julie's son is going to have tubes put in his ears, and so I want to make sure that, or just had tubes put in, I want to make sure that mom gets the following instructions and teaching sheets, and maybe a video on how to do whatever sort of care. And so that's a new project we're working on. So we'll talk about the early stages of it. And so that one happens to be another one where we're focused a lot on the data, and we have these great resources and we have content available. How do we go get that content, and how do we expose it and integrate it into, another aspect?
You're blowing my mind here. Here's what and as you're talking about this, I have to ask the question is, talk to us about the process, Julie, of like, how do you know when you need product? Like how, like I can understand when you've got an app out there and you could take a look at the data and you could say, hey, I think this is the problem here. But for new products, like how is that decision being made? Like, hey, we need to provide this. Is that coming from you and your team? Is that a marketing thing? How does that even happen?
I wish I could take, credit for and I come up with these amazing ideas, but I don't. I don't. This will sound very corporate speak, but it really comes down to, what are our strategic initiatives as an overall organization? What are we trying to achieve? And how can we achieve that in the expertise that our teams have? So my senior leader, my immediate leader, always see the possibilities. And for people like me who are more comfortable on the execution side, I love that I get to work for people that just see the possibilities and see where we need to go with things. And so, some of it is that we have a medical director who is dedicated to, I say dedicated, she's a member of our overall marketing team. And so a pediatrician who's no longer practicing, but is dedicated to us. And so, her vision to be able to say, wouldn't it be great if, as a pediatrician, when I'm working, when I'm doing this well child exam and mom or dad is in the room with me, wouldn't it be great if we could do blah? And somebody who understands the doctor, the provider, the patient, the family, as well as the possibilities you could tackle with technology. So for me, I am not that person. I wish I had more of that, but I get to work with people who really think about those ideas every day. And then I can be a part of that team that can help bring that to life. And I'm one part of that. I mean, it takes a whole team to execute on these types of things.
For sure.
You know what I love those? I'm hearing, and I think I'm hearing a lot of creativity. And I know this sounds like a cliche, but it's well, everyone's creative, right? Or it's we're all, but I'm hearing a lot of creativity in what it is you do. Just when you're saying you're looking at the data, it's well, I'm listening to you, Julie, and it's well, clearly you and your team, you're looking through the numbers, you're looking beyond the numbers. What does that mean? How can that provide a solution? It's, the old saying, it's all science, no philosophy isn't healthy either. And I'm just hearing a lot of creativity in what you do. And just as you described it, we have to see through the numbers, beyond the numbers. That's creativity. That's a big part of what you're doing.
Kurt, I really agree with you. If I would have thought of myself very early in my career or even in college and be I'm not really a creative person, I never felt that way. But as I grew in my career, I've learned that I'm creative in the sense of creative problem solving, creative solutioning. And I think then having, at least where we are at Children's, being a part of the marketing organization is inspiring then. We see creative branding and advertising and storytelling. And to me, that just kind of sparks the excitement and the inside creativity that makes it even just more fun to be able to come up with these technical solutions or these process or experience solutions. So I wholeheartedly agree. I mean, I feel like I'm a creative person, but in the, I was telling a candidate we were interviewing, I'm we're the nerdy part of marketing. We're the really nerdy part of marketing, but that's what I like.
So, Julie, we talked about this, but we're going to talk about it again and share share this with the listeners. Is how do you separate what you're doing versus like kind of a strict marketing person, right? I mean, there seems to be definitely overlap, right? Like if you're in marketing, a lot of places, they are responsible for looking at the data. They're responsible for reading the reports. They're responsible for finding those insights, right? That sounds like a little bit more maybe on you and your team's plate, but maybe not. So where does that handoff take place? How do you separate like kind of the church and state between you two groups?
To me, it is all one blurry gray space. I really think it is. And I think it's important. It's important, I think, for people to know, hey, what am I ultimately responsible for? And we're shifting as a team from goals to, OKRs, the, outcomes and key results. And I like that because at the end of the day, it's about here's the result we need to achieve. Here's what I can do as part of marketing technology to help us get to that result. Here might be something an advertising manager or one of our marketing strategists needs to do to get us to that result. Here's what our development team needs to do to get us to that result. And so it is so blurry, but I think that's okay. I think as long as we're all marching toward the same piece of it, what I think you have to be really careful about is to make sure that you don't duplicate work. And I think, I don't mind having, we are working, at least in our team for 2022, on being more analytics driven, more data driven. And I'm okay that multiple people could look at Google Analytics or look at reports or things coming from our site search vendor or wherever our advertising campaigns, because I feel like people can see different things. I think about it one way, Pat, you think about it another way, Kurt, you're thinking about it a third way. I think it's okay that we're looking at it each maybe the same data because we might have different conclusions, we might have different ideas, different insights, and based on our areas of time and expertise where we spend it, I might think about it from a user or from a technology, and you might think about it from, we just did this marketing campaign, and so I think it could have done better because of creative or this, and I'm looking at it going, but I don't think we did a good job of converting that person when they came to the website. Did we have the right calls to action, positioning things correctly, what have you? So, Pat, sorry, I feel like all my answers are very like, it depends, it's blurry.
That's a great answer.
Yeah, for sure.
But I think it truly is. When I think about product management, and I'm sure a lot of the listeners are like, okay, product management, that's really not my thing. And so, it might be more about like, let's talk about those skill sets. But when I think about, product management and even marketing in general, and when people say like, well, what do I own? And I'm like, we own the results, and the collaboration is key. If you are somebody who is very much black and white, I don't think product management and I don't think marketing are going to be your places. I think you need to be pragmatic, but I think you also have to have the team. You've got to have the team around you.
Yep, great. Yeah, that's a great answer. Julie, what I'm hearing is just a lot of innovative stuff going on, and that kind of blows me away. Just hearing about it in the medical space. Is children's an anomaly in this space, or are more hospitals embracing product management and this type of work and kind of the forward thinkingness? Can you shed any light on that? I'm just curious from a 3,000 foot level of what's going on in the healthcare space.
I think if you said product management lives within children's marketing and communications team, if you said that to one of my colleagues, I think they'd be like, what are you talking about? And I think the skills and the disciplines are absolutely in the marketing space. I can't really speak to a lot of other organizations. The few I know, I do definitely feel like they have those skills, processes, concepts in place, but they're not necessarily talked about that way. And it might be because they haven't had more traditional product folks coming in and don't think about it that way. Or it's because at the end of the day, if I do some product speak, our team might be like, what are you talking about?
Right.
And so I think a lot of it is just more the innate skills and the things that we do and say, okay, let's build a roadmap. That's certainly a product thing, but everybody understands the concept of a roadmap. Everybody understands the concept of here's our key initiatives and what are the tactics and things we're going to do to help deliver upon those. Everybody gets that stuff, but we don't necessarily have to talk about, agile development and different methodologies and life cycle management, all those things. The words don't necessarily, that doesn't matter. It's the work that's being done. That's my opinion on it. So I think we're going to see more and more of that because healthcare digital is just critical in the healthcare space, right? Whether it's rural areas who don't have access to, specialties and providers. And so, you read great stories from, Kaiser Health News, for example, of how somebody at a rural hospital might be having a stroke and they can do a video with a neurologist at a larger, facility and get that care where otherwise they may not. So I think there's that. I think, Pat, you and I were talking the other day about, we used to think about, the front door to a healthcare experience would be as you walk in the clinic, as you walk into the hospital, walk into urgent care. And now it's really, we call it the digital front door, but it is the healthcare front door. It's oftentimes a parent or even us, think about us as, consumers and potential patients. Where am I going first? I'm usually going to the website. I'm usually going to a mobile app to say, I need to schedule this appointment, or we're having this problem and I think I need to see somebody who has more expertise. And if I haven't spoken to my primary care doctor, maybe I'm doing a little investigation on my own. Where are you going to do that? You can do it on a website or an app or, wherever that may be. So I think we will continue to see the need for more and more product skill sets, the more that healthcare continues to provide digital tools and access for patients and families.
Julie, what a great wrap up. Thank you so much for being on the show. You've got the last word. How do people find you? How do they connect with you? It's all yours. Go ahead.
Dang. Best way to connect with me, I would say, LinkedIn. Definitely, reach out to me via LinkedIn that way. If you want to learn more about like product management and product management type skills and things like that, highly recommend the Pragmatic Institute. Used to be Pragmatic Marketing. They've rebranded to Pragmatic Institute. Great courses, webinars, stories, different things like that. Learn, subscribe, just subscribe to even, if you're using a technology or a part of your team is using a technology that would, like a marketing technology, subscribe to their stuff. They always want to talk about thought leadership and articles and things like that. One of my favorite groups that I used to lurk and now I participate in, it's a women in product group. So I know I'm sorry that discounts some of the listeners, but it's a Facebook group. And just this week, a member of the group posed a question about A/B testing and what tools do people use, and other, product manager type folks are saying, "Oh, we like this one," or "We like that one," or here's some pros and cons. And it's a very supportive group who helps people with interview questions, career stuff, as well as really tactical things too. So, beyond all of that, would love to talk to more people, would love to share, would love to help people if they want to move into more of this type of space. I will do a plug for the Children's Wisconsin app. Go to your Google Play, go to your Apple App Store, type in Children's Wisconsin, check out our app. And especially if you have children, you'll get access to easy to make those urgent care appointments, your primary care appointments, and all that sort of stuff. And give us feedback. Definitely, if you check it out and you have some feedback, feel free to message me. We'd love to hear more about that because we want to continue to make it better and better. It's just the first of many things we'll do to enhance, we'll continue to enhance that product. So, Pat, what'd I miss? Kurt? Anything else?
No, personally, from my perspective, before we sign off, I think you covered it all, and I think you delivered. You over delivered on what the expectations were, and I just want to reiterate what a great brand Children's is for all of us, and I do enjoy talking and meeting people that are a part of the brand and behind the brand, because what I was hearing from you is going back to what I had asked earlier. It's that genuineness and that passion and all of the things that you all do there, whether you're in marketing, in digital, a doctor, it doesn't matter. What I love is that there's a higher purpose. You all are going after the same thing. And that to me signifies that that's a very strong and vibrant and brand that gets it and is doing wonderful things. So I appreciate having you on. Thank you very much, Julie.
No, thank you.
Julie, thanks a lot. We appreciate it. We'll put all those great notes, comments, resources, put those all in the show description.
We will.
Sounds good.
Take care.
Thanks, you guys.
Bye.
Cheers. Thank you,
Cheers.
Julie.